Radical cystectomy remains the gold standard for patients with non-muscle invasive BCG unresponsive disease. However, bladder-sparing therapies are emerging. Here we summarize some of the recommendations of the International Bladder Cancer Group regarding BST for both CIS with or without papillary disease and papillary-only disease. Regarding sequential gemcitabine docetaxel, in patients with CIS with or without papillary disease, clinical studies have reported durable complete response rates in approximately 40% of patients at 2 years, with a 12-month maintenance therapy recommended. Adverse events are minimal, predominantly linked to localized bladder irritation. In high-grade papillary disease, sequential gemdosi has demonstrated strong efficacy with recurrence-free survival rates exceeding 60% at 1 year and 40 to 50% at 2 years. Secondly, we have nadofaragene firadenovec, which is an intravesical administration of a non-replicating adenovirus carrying the interferon alpha gene. In CIS patients, clinical trials have showed a 53% complete response rate at 3 months, with approximately half maintaining their status at 12 months. And this is accompanied by no serious adverse events reported. In papillary-only disease, NFF achieved a recurrence-free survival of 73% at 3 months, with 60% maintaining this at 1 year. Next, regarding nogapendikin alpha ebacicept, which is an IL-15 superagonist used in combination with BCG. In BCG unresponsive CIS, achieved a complete response rate of 71%, with a median response duration exceeding 2 years for many responders. On the other hand, for papillary Ta/T1 tumors, NAI in combination with BCG showed a similar efficacy with a 24-month recurrence-free survival of approximately 50%. Finally, with regards to pembrolizumab, in CIS with or without papillary disease, it achieved a 41% complete response rate at 3 months, with 14% maintaining their status at 18 months. The FDA approved pembrolizumab in this setting. However, it is important to note that 11% discontinued treatment due to adverse events. On the other hand, in papillary-only disease, it achieved a 12-month recurrent-free survival rate of approximately 44% and can be considered for patients with no other viable options. Its systemic nature and high toxicity profile necessitate judicious use, particularly in cases with significant comorbidities. To conclude, these are only some of the therapies which are proposed in this therapeutic area. However, radical cystectomy remains the gold standard for these cases. But bladder-sparing therapies are a growing area for patients refusing or ineligible for surgery. Comprehensive patient evaluation and shared decision-making remain paramount in setting the most appropriate therapy for each case.